Welcome, everyone. My name is Steven Collens. I am the CEO of MATTER. Today, I have the good fortune to talk with the innovation leaders of two of the country's largest health insurance companies, Healthcare Service Corporation and Anthem. Both organizations have invested a great deal in developing their innovation capabilities, and they've had plenty of occasion to exercise those muscles in the last 6 months. With 24 million cases worldwide, nearly 6 million in the United States, more than 800,000 people dead around the world, more than 180,000 dead in the United States, declining infections in the US, but rolling hotspots and shifting guidance from organizations that we should be able to trust. It is an exceptionally challenging time, with organizations large and small looking for ways to adapt and help. With that as the backdrop, Anthem, HCSC, and MATTER recently launched the Pandemic Response Challenge, a global initiative to help identify and help develop technology solutions that can help address aspects of this as well as future pandemics. And you'll learn more about this initiative later in today's program. My guests today are Trinidad Grange-Kyner, who is the innovation leader for Anthem, and Addison McGuffin, who is the Vice President Digital and Innovation Officer for Healthcare Service Corporation. Trinidad has been working at the intersection of technology and healthcare for 25 years and leads the team at Anthem that validates new solutions that advance the company's digital-first strategy. Anthem serves more than 100 million people. 1 in 8 Americans get their health insurance through Anthem plans. And in the last few years, the company has really built out its innovation and digital capabilities. And I'm delighted, Trinidad, that you are here to share with us some of what you are doing. Addison has been with HCSC for about 25 years and is responsible for driving digital, design, and innovation capabilities across the organization. He's held a number of leadership roles along the way in his career, and he built out an in-house technology incubator for HCSC. HCSC is Blue Cross Blue Shield of Illinois, Texas, Montana, New Mexico, and Oklahoma. It's the largest customer-owned health insurance company and the 5th largest overall, serving 16 million members. Addison, thank you for joining us. Throughout our conversation, if you have questions you'd like to ask Addison or Trinidad, please use the chat function, and I will incorporate your questions into our discussion. And finally, if you've signed up for the post-event networking that I mentioned earlier, you will get an email shortly from Kay Nietzkaj, who is from MATTER. And at the conclusion of this program, you'll need to exit this meeting and join a new one with the link that you'll get from Kay. So with all of that, let's jump into the conversation. Trinidad.
Yes.
Thank you again for participating, for joining us. The COVID-19 pandemic has turned the healthcare industry and really just about every industry on its head. How has this pandemic changed the way that your organization innovates?
Thank you so much, Stephen, for that introduction, and it's a pleasure to be here. Certainly, the COVID-19 pandemic has significantly highlighted the shortcomings and challenges of the US healthcare system. And quite frankly, the opportunity that's in front of us is to reshape healthcare with more predictive, proactive, and personalized solutions. And they need to address whole health, right? End to end, using all the technology that we have at our disposal. COVID-19 highlighted and accelerated the need, as we all know, to address those social drivers of health, including health inequities, as we address that whole health of the individual. And at Anthem, our vision is to be the most innovative, valuable, and inclusive partner in addressing the challenges facing healthcare today. So we're taking a platform approach to being a health company. We're relying on innovative solutions that we can quickly deploy to our members based on emerging needs, We're leveraging data, analytics, and emerging technology to deliver meaningful impact to people while the country continues to adapt to this new normal. When COVID hit, as you had mentioned, we were already well on our way to becoming a digital first company, but it certainly accelerated our innovation work. It pushed us to pursue even more partnerships and alliances like the one that we all have now, to expand our impact, because we really want to be proactively anticipating and responding very quickly to the needs of consumers for COVID, and let's be honest, future pandemics as well. We found ourselves in that unique position where we can connect parties within the healthcare industry. We can use our data proactively to identify hotspots and treatment options. And so very quickly after we all went into lockdown, we rapidly mobilized our teams and released a solution, one called the C19 Explorer. So that's an example of a digital solution that we created to enable government agencies and other organizations to identify evolving hotspots, inform those responses, predict reinfection rates and the availability of testing resources and hospital surge capacity. That's in the solution realm. And as we just mentioned, the collaboration is also key for us. So forming alliances and partnerships such as this one, and also like the partnership that we have with XPRIZE, which is that organization that hosts public competitions intended to encourage technological development for the benefit of humanity. Obviously, this is one of the greatest challenges that humanity faces. And so rapidly, we were able to stand up a pandemic alliance with XPRIZE, and that's a global coalition. It combines the power of collaboration, competition, shared innovation, and also that radical thinking that we all need to accelerate the solutions. And within that pandemic alliance, we have a number of different initiatives, from an exchange where all the alliance partners can exchange ideas and really build upon each other's ideas, all the way through a data collaborative where we can actually transparently connect our data sets and actually look at ways we can make a difference with the fight against COVID. And we also have launched a couple of campaigns through this. We've been working with Microsoft, MITRE, Mayo Clinic, and other organizations within XPRIZE to launch The Fight Is In Us. That's a campaign to build convalescent plasma biobanks, which really is required for us to help each of our partners and our researchers, academia, really leverage that data and plasma to research some new therapies. And most recently, we actually launched a $5 million rapid COVID testing competition. Again, the idea here is to spur that innovation globally, because we're all focused on how can we return to work safely, return to school safely for the children. And so with this $5 million XPRIZE, we're hoping to spur partnerships and competition for people to actually think through, how do we develop a test that's fast, turnaround, cheap, accurate, so that we can quickly catch those COVID-19 occurrences before they become outbreaks. And these are just a few of the ways we've had to adapt very quickly to COVID-19, and we've done it in collaboration with a lot of different partners.
Fantastic. And on that point about a test that's rapid and accurate and cheap and that anybody can do, we actually have a Matter member company that has developed one of those. So we're going to send that your way, and hopefully they'll win $5 million to develop it and scale it. I just want to dig in a little bit on one of the other things that you mentioned, though. You mentioned C19, which I think it sounds like a software product that you built, if I understood it correctly. And maybe you could talk a little bit about, what does that look like inside your organization? Do you have software development capabilities, and how did you put this this particular solution together?
We do, actually. So as you'd mentioned, Anthem committed to turning itself into a digital first company. And so we've invested very heavily in looking at our digital tools and capabilities. We have a number of different data scientists and technology teams that are hard at work on the solutions that we provide, both to our consumers, but also to folks who are not Anthem consumers. And so this is an example of a solution. It's actually a web link, C19Explorer.org, I believe, which we launched, and we made it available to everyone. And you can go in and look at right down to the county level, all up-to-date data on COVID-19 occurrences. The idea here is we were able to pull together different data sources and put it in a way where it's up to date and really helping to inform some of the responses that we believe lots of different organizations are building.
It's great. Addison,
Still here.
let's talk about HCSC.
Sure.
You've been there for many years.
Yeah.
And you've been leading the innovation team for a number of years, for I think as long as I've been working with you.
Yeah.
How has the pandemic changed the dynamic within your organization and the focus, and what have you really been focusing on addressing over the last 6 months?
Sure. So I think, Trinidad did a great overview of a lot of the digital capabilities that I think actually all of our organizations had to come up to speed with quickly, maybe adopt and accelerate some more, I would call it direct to customer capabilities that we may have had, for instance, in the pipeline to release, but we actually needed to then accelerate some of those capabilities again so that we could, serve the needs of the people that we are mission to care for every day. And so one of the things that I would say COVID has done is it's caused us to rethink, if we're specifically talking about, the services that we provide every day, it's caused us to rethink about, what are those things that are the priorities. And if you look at each one of our organization strategy, we have a very community focused architecture that basically says, let's make sure that the communities in which we operate actually have the capabilities and the resources necessary to support all the people that live, work, and basically have to thrive in those areas. And so, to that, one of the things that we've had to do is kind of say, okay, as we look at innovation, as we look at those things that are typically very human-centered and research-oriented, where we need to go into the environment and kind of understand, really the essence of what needs to be created or explored from the mind and the eyes of the user. We've had to kind of come up with, new ways to do that. And so, even though we still do that research, a lot of it is now dependent upon interpretation for, users that we enroll to provide, those more insights. And, we have to be better question askers, maybe even more deliberate question askers than observers, where we actually had that benefit to immerse ourselves, in the user's environment in the past and basically make observations and qualify. Now we have to be, more like detectives than anything else. So I will say the innovation process itself, our solution, pursuit or capability pursuit model has evolved because, now we, of course, have been restricted in doing maybe some of the things we had the freedom to do in the past. And maybe with everyone's also caution about interaction, we've had to kind of rethink that model as well. So I'd say that's one thing. I would say, again, the focus that Trinidad brought up on data, critically important. Our organization has always invested heavily in understanding and developing a kind of a comprehensive data and intelligence platform capability. But I will say, and I have to give credit definitely to, the leaders within our data science and analytics organization. They did a fantastic job of bringing together pieces of information in real time that, again, allows us to not only operate our business, but understand the impact of services that we're offering, understand, how to dynamically refocus or reprioritize certain capabilities, whether it's down from our telehealth and, being able to kind of figure out how to add more capacity in that space to, maybe things that we need to do from a process and operations perspective. So again, a big lean in, very creative, very innovative, and accelerated, I'll call it, assets that we're going to be definitely using forward and extending into our ongoing operations, beyond this. Another thing that you, hit on a bit is, how have we had to look at this differently? And it's interesting because, no one wants a pandemic. This is the, kind of the worst situation, for us to be in. But through this, through the loss and kind of through the recognition of our, I'll call it mortality, it's also forced us to challenge certain things, and it's that, I would call it almost that pressure cooker that says, of the things that we're doing, what are the things that are most important? And then if there's something that we need to fast fail on, or we need to maybe reevaluate the business, opportunity or priority of that particular capability, it's forced us to do that. And I think it's not just us, I think it's probably happened to everybody, but very noticeable in healthcare, and definitely, those things that are very valuable to people. One thing I will say, here's a great example. In some of our areas that you mentioned, we actually we wanted to make sure that folks had the access and coverage to care that they needed. So we promoted and accelerated health telematics capability. And while we didn't build out the core technology, we became great integrators, and then of, I'll call it, health appliances and technologies that were available in the marketplace, but then tied those back into our care delivery models and our process that we actually have, which actually those off-the-shelf capabilities don't necessarily support out of the box. So we are able to integrate and synthesize the benefits from things that are novel and available to all of us consumers with, again, processes of care that typically then makes those things that much more valuable. And with that, we were able to address thousands of lives that we would not have been able to through conventional processes that we had in place before. So I'll pause there because I promised you I would be brief today on my comments. So
well, it's great. It's a great overview, and I just follow up with you. How much of what HCSC has implemented that is different in response to the pandemic, and maybe extrapolating how much overall and how healthcare has changed as a result of the pandemic, how much of that's going to stick? How you mentioned telehealth, telehealth, synchronous telehealth visit utilization has gone up by multiples that don't even fit on a scale. And, what of these things are going to be part of our lives for the, for our kids never going to know anything different?
Yeah. And so, I've heard this phrase used many ways, new normal. I really like the one I've heard recently is new next. This is our new next, which means everything that we're doing now, we're going to be doing from now on. In fact, I think we're going to be doing more of some of the things that we're doing now, specifically when it comes down to how we now engage the consumer of the services that we're providing directly versus maybe traditional means. Because just think about it, people are more aware of capabilities because they've had to think about it every day. Do you have your mask when you go outside and go out the door? Pretty soon, we will probably see things like, are people vaccinated or not? When we go into certain locations, it's going to be more, it's not only awareness, but it's also practice and availability, because I think what's happened now is the bar has been now reset. And also the other business models around delivering these services have also been forced to evolve. A lot of times, and Trinidad will tell you, we can introduce a lot of innovation and it's fantastic, but then the inertia of the system itself then slows down or drags that innovation back. What's happened here now is all of that's been pushed forward at the same time. And so we have to figure out how to really kind of create the sustainability model around it, not just kind of the episodic, put the Band-Aid on it and, hope that it stays on for as long as we need. So
yeah, Trinidad, I'd love your thoughts on that. And you mentioned, which I don't think is specific to the pandemic, but you mentioned that the direction you're driving is towards healthcare that's more predictive and proactive and personalized. And I think a lot of what Addison was just talking about are solutions that have kind of been implemented more broadly as a result of the coming out of the pandemic. But wondering, of those, do you have the same view as Addison? Where do you see, technologies really sticking, and where do you see us kind of, rubber banding back a little bit?
Yeah, I mean, definitely we're in agreement. Without a doubt, we've seen that shift from the physical care setting to the virtual and, using the digital tools as well. And the important thing I think Addison mentioned is these tools existed, right? We already had them, but it was that inertia of the system, like you mentioned, to actually adopt them that the pandemic has somewhat, taken us past that. And so what we anticipate will continue to happen is that those modalities, those virtual and digital tools will continue to be used, and folks will look at, the physical care setting as potentially reserving that for, situations where it's deemed necessary, which in itself brings its own challenges, but also helps us have a dialogue around, for this individual, what is the best care setting? Right, that personalization, being proactive about, hold on a minute, if we have a smart sensor that is detecting something going on here, what are those intervention points that are reasonable for this individual, but also cost effective in order to intervene at the right time? So we certainly see that is going to be a continued change. And without a doubt, I mean, the genie is kind of out of the bottle, right, as far as how much the social drivers of health make a huge difference. And so that change, I think we're going to just see continue to snowball. We do need to be very much more aware of those environmental factors that are impacting, the outcome of healthcare, right? The health inequities, the chronic conditions that are plaguing certain groups of people. These are things that we are going to need to continue to address, but have somewhat come to, I'll say, to the forefront of everybody's minds, through the pandemic. And the other thing you mentioned, Addison, is just, I think, as time goes on, we're having a little bit more time to pause and think, how do we make our healthcare system sustainable and resilient? Right? We've all seen where it all kind of fell apart, where the screws started getting a little loose, right? And so when you were asking, do we have data scientists, I'm believing that within all healthcare, actually the way I put it is, every organization right now is a healthcare organization. Every one of them is considering, what does it take to open my business or run my work? And they're now thinking thoughts that typically they wouldn't have bothered thinking about, right? When it comes to their employees, okay, what's their temperature, et cetera. And so we need to capitalize on that and recognize that there are lots of different adjacent industries that we need to form those more stronger coalitions with, right? The data that needs to be transmitted, say between, let's say, the supply chain industry that was supplying the PPE and the actual organizations that are serving the individuals that need the care. Those kinds of changes, I think, have already started and will continue to accelerate as we move forward.
Yeah. Can I add one more thing to this? And I think this, which is important, is Trinidad hit on it. This collaboration between ecosystem players. I mean, that if anything, this experience that we have has really kind of forced the whole getting people to operate out of kind of a pure competition model, you know, to maybe more of a co-opetition model. Yeah, but then making sure that those things that are necessary to make all of the stakeholders successful and incentives aligned are actually happening. So whether it's, you know, data or, you know, information sharing in real time, or, you know, the adoption of standards, you know, in order to do that, you know, we're seeing a lot of that. And Steven, I don't know if you see, like, for instance, even from the private equity and VCs, you know, energy in that space, maybe like not like it's been before, because of these collaborations and because of these unique configurations that are now coming together to share like they've never done before.
Yeah, I mean, the pandemic is it's a public health and economic catastrophe, and it, I think will turn out to be one of the, you know, probably the greatest accelerant of digital health technologies and novel collaborations across healthcare that we've seen, because it's forced people, as you said, to rethink the way that they're doing things. So it's going to be really, really fascinating. I want to shift gears just a little bit and talk about your own organizations. And, you know, Matter works with dozens of large organizations, and they all struggle with innovation in their own ways. And, you know, the things that make large organizations very successful at being big organizations, processes and the discipline and the systems and the rigor, and, you know, are often work against rapid innovation and the kinds of things that can really make organizations develop disruptive and scale disruptive ideas. And, you know, how have you created cultures within both your direct teams, but also within the broader organization that cultivate innovation, that allow for the inherent failures that come with trying new things and the risks that go along with innovation? How, you know, Trinidad, we'll start with you, but, you know, how does that work? How are you successful at doing that at Anthem?
No, you've highlighted some of the pitfalls, shall we say, of innovation. But certainly what we found is it's very important to create and promote that culture of innovation. Within Anthem, it is something that's within. So every employee is very much aware and has, you know, culture conversations that embody our bold goal to become that digital first health company. But it also comes from the top. We are really fortunate to have a CEO, Gail Borduro, who has a vision and will speak very eloquently about it. And as they say, you know, do what she says, right? Really support those innovative ideas and platforms that we're building, because it is taking a lot, but knowing that this is where the industry is going, without a doubt, right? Knowing that for a fact, then those little failures along the way are all just learnings. And so we're not afraid to take chances. We know the problems in the healthcare system is going to need those bold moves. And so we're here to transform health, and we embrace that being aggressive as possible when it comes to the timeline. You know, just as we've all mentioned, you know, no one could have really predicted the pandemic. But what was, I guess, eye-opening for all of us was when it did come, we were prepared. We had already started having these conversations. We already knew the direction that data and platforms and, you know, working collaboratively with startups and other organizations and academia, et cetera, could get us. And so this has really just accelerated what it is we're doing. Within Anthem, we really try to be very focused on the ultimate path that we are going through. We look at different solutions. We're really trying to source that supply side of our platform by working with a lot of different startups, but I'll understand that data so that we can predict where the demand side or the consumer, what they're going to need, and really facilitate that relationship between the two. We also emphasizing within our culture collaboration. We've already talked about the coalitions, and I think Addison mentioned co-petition, right? So one of the things we launched was the Health Utility Network. And that itself was a bold shift because we looked at what typically would be competitors and said, where is this industry going? What are those utility problems that we are all spending millions of dollars on that we can solve with technology? And so we chose blockchain as that platform and really looked at how can we solve those data challenges. And that isn't just an external thing, that required internally for us to have a different mindset in terms of who are we working with. And finally, Addison definitely mentioned that again, when something as dramatic, shall we say, as a pandemic comes along, it really sharpens your focus. So we are very much focused on impact. And a lot of the things that would trip us up within big organizations where you are trying to get somewhere, we're very, very much conscious of what is it that we're trying to solve? Can we validate this very quickly? What are the success metrics? Who is telling us that this is the problem that we need to solve in this particular way? And what we've been able to do is really fast track that as much as possible. Recently, we just completed our inaugural Fast Track to Scale Accelerator, for example. And there we took our innovation cycle and we compressed it. We brought our employers, we brought startups, we brought our subject matter experts, and we said, what is the problem that we can solve with this startup solution? We identified those use cases. We went as rigorous as we could in designing studies. Addison was mentioning, like really looking at those data points so that we're truly measuring that this solution is making an impact. And then just, you know, thinking broadly, if you create a use case that applies to one particular segment, how can you apply that more broadly to all the different segments? So that experience and what we continue to evolve with has really fed into not just, you know, talking about innovation, but actually feeling it and seeing the impact of what we can do with the right mindsets.
Addison, how do you do that at HCSC? How similar is your story, do you think, to what Trinidad just said? What are the tools or levers that you use that other, you know, people from large organizations who are listening and hoping to enhance the innovation capabilities of their teams ought to take away from your experience?
Sure. So again, some similarities and some differences, you know, the Trinidad's kind of overview. I think, you know, with HCSC, you know, when we sparked, I'll call it our enterprise innovation focus, you know, we had to do some selling to the business that this was, you know, not just discretionary, it was necessary. So, you know, we had to basically build up internal credibility around being able to take a concept through, again, this multi-phase incubator that we set up, and then from that point be able to create value and, you know, get it really aligned with the process or the system that sponsors that capability and, you know, takes it into full production. I think you said something very it's very real, and probably many folks that, if they're on the phone who've gone through this, knows that, the operating system for, the enterprise turns at one speed. The operating system for the innovation platform turns at another speed. A lot of times these things create friction when you bring them together, and sometimes there's sparks that fly off. And so the trick is, how do you get those things that are meaningful and, say, purposeful and valuable, for instance, to the enterprise operating system, but at the same time, make sure that you continue to advance your innovation agenda as well. So that means that you have to have, first of all, you have to build trust and credibility, inside of your organization. And that's kind of that's not an everyday win type thing, because you think you may be up one day and then things twist on you, or you may lose a sponsor, or there might be some other things that happen as a result of building alliances and credibility and familiarity along the way. And if you lose a champion, guess what? You have to start over again, or fill that gap with others. So I think from that standpoint, it's been a journey where I think we've put in a very good process to move an idea through its inception. And we've actually then created, I will call it, focus areas from incubation to exploration to empowerment within really kind of our structure. And so, with that, with regards to the incubation piece, we're looking at white spaces and looking at opportunities to create capabilities that, again, extend the impact of our strategy, again, to not only the markets that we serve, but even potentially adjacencies. On the exploration side, we are, starting, 10 to 15 years out, and then backcasting to where we are today and saying, based on these particular capabilities that we see emerging, what can we do now to start building, those foundations and that infrastructure to kind of get us to those capabilities. So for instance, Trinidad brought up the Health Utility Network. A lot of history with this one, because we were one of the early collaborators as well that made the decision to say, we need to do this particular, create this particular capability within an ecosystem that was evolving and changing. And, who would have thought that you could get, insurance companies and providers and banks and technology giants to actually come together with a common view and mission that, ultimately then would solve, I would call it at least most immediate, very similar challenges that each one of the organizations have, and then position a platform to do transformational things that now, once those pieces are working together, creating, that environment in which others can then contribute solutions and capabilities, and, and then create that network effect for actually making impact on, on the everyone that this particular environment serves. So who would have thought we would have been able to pull that off? Now we're to a point where a capability like that is poised to enter the marketplace. So that's an example. I will say, lastly, the empowerment piece, because I think it's very important to maybe have dedicated teams that actually inspire and then kind of work every day within the, I'll call it the march of innovation. But I would also suggest that you need a innovation network that, is comprised of the employees. Like Trinidad said, it has to be an energy that is both grassroots as well as kind of top down. And so how do you engage that? And we, to this point, we have, over 1,000 innovation network members who are employees that actively participate is we can engage them on certain experiences that we have in taking innovation to market. So again, you have to work multiple angles. You have to work the organization and leadership angle. You have to work the kind of outside in, how do you get, capabilities and or collaborations in place? How do you use, for instance, the power of a matter, for instance, which is the reason why Anthem and HCSC are both, part of the matter ecosystem as well. How do you leverage that in extending your capabilities? And then, how do you make sure that, the people who actually have the knowledge and are the subject matter experts have kind of the space to actually invest in creating new capabilities that then benefits, again, the mission of the organization. So.
Yeah, so I have so many questions about what you just said, and I find this topic so interesting. And how I spent 10 years in a very large corporation and have operated in the startup, and I think just what you've done is really interesting, and how you've done it, I would love to dig into for the next 2 hours. But we're not going to do that. So let's talk about the challenge. So Anthem and HCSC and Matter recently launched the Pandemic Response Innovation Challenge, which we alluded to before. So if you haven't heard about this, not you two, but other people who are listening, so this is a global call to innovators working on pandemic response solutions, looking for behavioral health solutions and data solutions that can help reduce the strain on our healthcare system today. It can help prepare patients and healthcare providers for a stronger post-pandemic world. So at the end of this program, in about 10 minutes, we'll share more about the logistics, but I want to ask each of you a little bit about the nature of the initiative, and maybe start with, so there's two different tracks. So one is focused on behavioral health, and the other one's focused on kind of data solutions. And Trinidad, starting with you, there's a data track. What are you looking for? What is and why focus on this? I mean, this pandemic has created, as I think Addison said earlier, just, exposed so many fault lines in healthcare. We could have focused this initiative on any of 100 different things. So Trinidad, I want to ask you kind of why data, and Addison, I'll ask you why behavioral health after that.
Thank you. And again, it's super exciting that we're able to launch this challenge, these two challenges actually. For the data piece, as we've alluded to throughout our conversation, we really value the information, the innovation that comes out of the startups. What we've been able to do is craft a data sandbox challenge. We're inviting the startup community to submit real solutions that can leverage the data. Folks haven't heard about our data. We do have clinical behavioral pharmacy claims within the Anthem data sandbox. And I'll give a little more detail about that. A few years ago, we were able to create a digital data sandbox, which offers vetted users with the ability to build and train algorithms, validate those solutions with our Anthem experts, and deploy those solutions within our digital platform, which obviously reaches millions of consumers. The data sandbox itself uses certified but de-identified data, right? This is obviously very hard to do, but we're very much focused on protecting the privacy of individuals. And so there's no identifiable information within the sandbox. However, it does contain over 14 years of longitudinal data with more than 40 million unique lives in our commercial lines of business. It also, recently, we refreshed it so that it has thousands of COVID-19 related diagnoses. It has over 6 billion medical claims, 2 billion pharmacy claims, and 6 million electronic health records. And our idea here is that this is one of the largest data repositories for data scientists to really, I'll say, play with, right? Hence the term sandbox, right? Really play with it, look at the solutions or models that you're building and test them against this data sandbox. And our goal here is we've kept it very open, right? The behavioral one is very much focused on a particular condition, where here we've just left it really open. What can you solve in this pandemic world with the additional data that we've been able to provide?
Great, thank you. And Addison, same question, but behavioral health for the entrepreneurs who are interested in that side of things. Why focus on behavioral health, and what are you looking for?
Yeah. So, right now we're in this moment where, people's well-being, specifically, condition management, not only staying healthy is important, but also understanding the dimensions of, what that means. What I mean by that is there's the physical side, which we concentrate on because, it's very visible, it's very pronounced. As you started out, it could be even almost fatal. There is all of the other factors that then go around maintaining that physical well-being that specifically given the situation or the posture that we've all been put in, that are challenges, and they were challenges even before the pandemic. So let's not just say that the pandemic caused this wave of behavioral health issues. They were byproducts of social determinants of health and other conditions that people have to deal with on the daily. But I would suggest that what the pandemic has done is, again, that pressure cooker effect has now kind of created and expanded the need for us to look at conditions that are not only related to anxiety and depression, but that are also spurring other I'll call it tangential or kind of ancillary situations that we need to deal with. So, what are the byproducts of us all being together in the same place for 24 hours every day? I mean, I'm sure our pets even get tired of us being around. Like, when are these guys ever going to get out of here? Give me our place back. But you've got so parenting challenges and stress. You've got unemployment. I mean, given everything that's gone on with regards to the economy, and hopefully things will start moving in the right direction faster. Let's put it that way. Just given maybe what we're trying to do from the financial space, but then also there's a lot of folks that have had to kind of take a step back in this because they've either been let go by their employer, or they've actually, maybe I do know people who have just said, hey, this is my moment where I need to start figuring out if this thing that I'm doing is my passion. Am I living to work or working to live? And I really applaud those folks too, because we still need a source of income and whatnot, but that creates a set of stressors. The isolation. There might be people that are in certain circumstances or predicaments where they are there stressors that are created by being cut off from help that they either don't know that they have access to or are afraid to reach out to, which then stems other things like substance abuse or and then honestly, people are also afraid to maybe even reach out. So there's a stigma associated with getting support and help. And so the question is, how do you create, a system in which holistic health, is considered, where it's not just physical, but mental. Because again, we've got, over 40% of Americans reporting, issues associated with behavioral health. And again, those needs are as critical as, as we deal with the physical side. So the question is, can we create end-to-end systemic solutions that, drive not only awareness, but allow us to take action, and then we can measure change and impact based on that. And then actually, like we've talked about here, how do we share that information? How does that become intelligence that we can then build capabilities and or support systems from a digital first perspective?
So, Addison, really quickly, you've got a magic wand, you can wave it, and out of this challenge, there we go, comes one behavioral health related solution. What would it be? What would it do?
What would it do? One of the things that we have a lot of, I'll call it technology that we've all now gotten very good at using, whether it's video conferencing or what have you, that's become our new normal. I think the one thing that could tie us together better would be, again, thinking systemically, thinking about, how this particular capability then connects to other things that then drives a change or an outcome for the better. I believe that we need to start thinking, I know we've talked about this kind of AI for the individual, but it would be great to actually have a companion that is, they're sensing more than just maybe your biorhythmic information, but mood and, other dynamics, even environment, and acting, on your behalf. I would just say helping to provide, I will call it real-time direction, guidance, navigation, specifically if you are in a particular state for the day. Because one thing, whether it's your Oura Ring or your Apple Watch or whatever else, that, there's a lot of data that's coming at us all the time, and it's good information, but you have to figure out how to bring all those pieces together. And so I would say we're at this leap point where, we're getting used to our technology working with us and not just for us. So I would love to see a systemic solution that kind of integrates conditions that would then actually give a person, the ability to kind of help navigate their day based on integrating all these pieces of information together. That would be my magic wand wave.
Awesome.
So is that too much, Trinidad? What do you think?
You've got a magic wand, Trinidad.
It was
on
perfect.
the data side, data challenge.
I've got my wand. Waving my wand, it would be that, by looking at the data, and as I mentioned some of what's in the data, we also have prior virus outbreaks. So we have H1N1 SARS data. Can we use that, extrapolate with the COVID data, and truly in a predictive way, predict the next pandemic? Can we find patient zero before it becomes a global pandemic? Is there anything we can do? So that would be my magic wand there.
Nothing to it.
Nothing. Because unfortunately, as we know, it is coming. Another pandemic is on its way. So let's get ahead of it.
Well, Trinidad and Addison, thank you so much for joining us today and for sharing your insights. We're really looking forward to continuing to work with you on this program and others. I'm now going to just turn things over to my colleague, Gina Konstantakopoulos, who is going to share more details about the logistics and particulars of the challenge itself.
Thank you, Steven. I appreciate your introduction. We're absolutely thrilled to be telling everyone on the line today about the Pandemic Response Innovation Challenge, sponsored by Anthem, Blue Cross Blue Shield of Illinois, and Matter. First off, I encourage you all to visit our challenge page. You can go to matter.health and find our challenge section. Also, the challenge page will be in the chat feature shortly here, so you can link through and take a look for yourself. But we did just want to spend a few moments highlighting what the challenge statements are, as both Trinidad and Addison have very eloquently already dived into both the tracks. We'll tell you a little bit about what's happening. There's a behavioral health track that asks, as payers, how might we enable individuals to recognize their behavioral health challenges and help them identify and activate solutions that address those challenges during and post-pandemic. And also a data sandbox track that says, as payers, how might we leverage the data we have collected from the COVID-19 pandemic and past pandemics, as Trinidad pointed out, to sustain and improve patient care and outcomes during this pandemic and in the future. So using these as kind of your guiding lights, just a few things that fall to each of the tracks as examples of the types of solutions that we're seeking. For the behavioral health track, things that touch on domestic violence, parenting stress, unemployment stress, issues of isolation, substance abuse disorders, and really, removing the stigma, and things that certainly work in concert among many of those. Likewise, on the data sandbox track, using the Anthem.ai and the resources there, please visit the site and you can see a lot of great data dictionary and additional resources associated with this. But examples that we're seeking to have folks fill out are around preventative care, surge capacity, risk stratification, testing, contact tracing, and non-COVID-19 care. So things that really help us to manage other diseases that are on the periphery or that help any of those other things like surge capacity. A little bit about the submission criteria and the challenge timeline. I'm not going to go into every line here, but please take a moment to review this to see if your solution meets the criteria. We really are welcoming folks from all over the globe. So no matter where you sit, your ideas are very much sought. So do take a peek and see if you fit these requirements. We've already launched. We actually launched last week, but applications will close the 27th of September. So keep that date in mind as you're working towards things. The week of October 12th, we'll announce finalists, and then we'll have our final pitch event. There are some submission steps, but really the thing I want to highlight here is that the top solutions in each track will have an opportunity to pilot at Anthem for the data sandbox track or at Blue Cross Blue Shield Illinois for the behavioral health track, which is a huge benefit to really get some rubber meets the road for your solution. Additionally, and we're proud to say that the winner of each track will also be awarded a complimentary one-year membership at Matter. Again, please visit our challenge page for more information if you have any questions. You can also email us at 19@matter.health and we'll be able to answer your questions. Thank you for joining us in Matter here today.